I guess what I think would surprise people about my role as a psychologist in a learning disability team is really just a huge variation in the work. I guess you are meeting people with all different kinds of circumstances, all different kinds of experiences, and all different kinds of issues of concern or problems of concern. So you end up gaining a lot of skills in a lot of different ways of working. And I think that makes the job, really interesting actually. And it means that you get to keep learning in a way, growing your skill set. I think there's also, a huge role for clinical advocacy, and I guess using the role of a clinical psychologist to really, advocate for people to have better quality of lives. And that's something that personally, I find quite fulfilling about the role.
I think what might surprise others to know about working with people with learning disabilities is that you don't have to be part of a specialist service to have a positive impact on people with learning disabilities. There are far more similarities than there are differences between people with learning disabilities and people without learning disabilities. However, because not all services regularly come into contact with people with learning disabilities, some professionals may be anxious when seeing the learning disability label. Seeing beyond the diagnosis and getting to know the person can be hugely powerful and shows how far compassion and understanding can go by themselves. What most surprised me when starting to work for a learning disability service was the relatively sparse amount of research for people with learning disabilities and the low level of public awareness. Learning disabilities is often mistaken for specific learning difficulties such as dyslexia, or from neurodevelopmental conditions such as autism. A lot of work is needed to be done to improve public awareness, which would benefit from more research and more consistent terminology within the field.
I think probably how interesting and diverse the role is. I think perhaps some people might think that learning disability psychologists do less or have a less range of things they do, as people have communication difficulties that might get in the way. But my experience is that the variety of work and the flexibility to use different models and therapies is actually greater because you see such a range of people. I think also perhaps people might think that forming therapeutic relationships with this population might be difficult. But my experience is that it's very much possible, and in fact the strength of the relationships with service users and with families can be even more powerful. So sometimes these clients are excluded, marginalised, isolated, and so your support coming into a network can actually be life-changing.
What has surprised me most about working with people with LD, I think, is how hard you want to work for those people. Because sometimes I think people forget that people with LD don't always have a voice that can be heard. So people in the departments are sometimes their voices. So I think that's what really, really surprised me most about working with LD, is that me wanting to work so hard to make sure their voices were heard, they were valued, and they were understood.
So there are various myths around working with people with learning disabilities, such as that most of your work is with challenging behaviour, or behaviour that challenges, and most of your work is applied behavioural analysis or positive behaviour support informed. So there are people on my caseload who do display various concerning behaviours, and PBS can be really valuable in certain cases. There's something that is really helpful that clinical psychologists can add to a learning disability service particularly, I think, is that we are trained in a wide variety of ways of helping people. Different individuals with complex and different needs and preferences can sometimes call for very different approaches. I feel very fortunate at times to be able and to have been exposed in my training to various different ways of helping people. And this allows me to be quite flexible when offering help and support for individuals and teams and families.
like I said before, I don't just do PBS plans. I do all sorts, which is just fantastic. So, I mean, I love so much about psychology and so many different things about it. Working with people with disabilities is great because I get to do bits about our mental health. So for those individuals with quite a mild learning disability, we can work together and help the person think about their thoughts, think through quite complex, abstract psychological concepts without really much need for adaptation. So I get my little bit of adult mental health fix. I do work that might be seen in child services for those individuals who do require that bit more adaptation and creative ways to help circumvent understanding difficulties. So I do that as well. I do bits of older adult work, so I work with individuals who may have a dementia, attend memory care pathway meetings, so I get a bit of my older adult fix, so to speak. Individuals with an eating disorder, I don't have that clinical threshold, but for individuals who are having eating difficulties, I can work with those individuals. So that might surprise people that, like I say, it isn't just your stereotypical meet with someone and then go through the whole process of a PBS plan. I just do so much work on different concepts and different people, different meetings. That's just brilliant, and I cannot really emphasize enough really how much I love my job, how much I love to get up every single day, go into work, do what I do, because it's just so varied and definitely keeps me on my toes.
I think when I first started thinking about working in learning disabilities, I feared working with people who display behaviours that challenge. I think it's a lot of what people talk about in terms of learning disabilities. That and the difficulties with communication. I think people, and certainly trainees that I've worked with, have feared, and assistants have feared how to communicate. Not knowing how to communicate with the person, and also the person is presenting quite a lot of risk or behaviours that challenge, and that can be quite anxiety provoking going in. But I suppose what I've learned is that a lot of the people we support don't display those behaviours that we're thinking we're going to see. They're just simply showing distress in the best way they can. And also in terms of communication, I think I've learned that quite a surprise is that people with learning disabilities are really resilient and great at saying, you know, I don't understand that, I didn't understand that, and I've got better and at adapting my communication and owning it if I don't say something the right way. So I think that surprises everyone when they come on placement with us, either as an assistant psychologist or as a trainee, and then, you know, when you go on to work qualified, actually it's different to what I thought, and I just absolutely love it.
Because the role is so varied, it gives you the flexibility and opportunity to try out different ideas and work in creative ways and specialise in almost any area of clinical psychology that you choose. The amount of indirect work may also surprise some people, working with and supporting families, carers and other professionals and teams involved in the person's care. So I hope this gives you some idea of what it's like to work with people with learning disabilities, and that you might consider this as a future job or career. Thanks.